My next guest was part of today's higher education hearing. Like Chancellor Zimfer, he believes SUNY is being hit too hard with cuts, and he's calling for millions in funding to be restored. Phillip Smith is the president of United University Professions, representing thousands of SUNY workers. Thanks for your time tonight.
Thanks, Aaron. I'm pleased to be here.
So, over the past 3 years, SUNY has been hit with about $585 million in funding reductions from the state. This year, another $1 million reduction is being proposed by the governor. Can you just explain to us what sort of impact that would have on the students, the schools, and the professors that you represent?
Sure, yeah. Well, it's a devastating cut. If this cut goes through, it'll be $685 million, as you point out, over a period of 3 years. And I think people need to understand that those are ongoing cuts. So, you know, the first cut hurt, the second one hurt more, and so on and so forth. And now we're down in a period of 3 years to potentially about 7. $685 million is basically equivalent to eliminating 8 of our 29 SUNY campuses. It's huge. I mean, it's a greater cut than the spending on the University at Albany and University at Stony Brook combined. So these are really devastating cuts. They can't be good for students. They certainly aren't good for our members. But let's focus on the students for a moment. Students right now are scrambling to get into State University of New York campuses. If they do get in, they're finding it difficult to get the classes they need, and especially those students who are in their junior or senior years are sometimes finding it difficult, if not impossible, to get the classes that they need to line them up for. That's right. And, you know, that's where my members come in, because it's my members who are the faculty and the staff who provide the educational services, either being professors or, you know, support staff of various kinds. So as we have lost numbers over the years, you know, it's become an impact on the students. And I think one of the things that we have to keep in mind is that there are really 2 factors to this, and that is if a student is delayed in graduating beyond the normal, let's say, 4-year course, it's going to cost them and their family more money. It also costs the state more because, you know, they have to kind of repeat or redo the educational services that they would have normally gotten in the regular span of time.
Do you know if this is going to mean a direct cut in faculty? Have you heard that, or?
Well, you're very much aware that here at the University at Albany, they've planned to block or suspend enrollments in 5 programs. There are 3 programs at Geneseo that are in a similar situation. We've already had some services at our systems administration eliminated. We've eliminated the NILINC program, which provides very vital services to not only SUNY libraries, but 200 or more public libraries across the state. New York Network is losing some of its employees. And as the funding contracts, I can see no other way of keeping the university going without losing more faculty and staff, because quite frankly, the bulk of the budget, some 80%, is in personal services, that is, salaries.
And as we mentioned a little earlier in the show, the hospital subsidy from the state to SUNY schools is also going to be cut by about $135 million. And what sort of impact are we looking at there?
Okay, well, the number is $154 million. It is a subsidy that has been in place for some 20 years. I happen to be from the hospital campus at Syracuse, so I know, you know, in my backyard, it's the community and the hospital will be in crisis, and I'd like to try to put that into some perspective. The public hospitals, the 3 SUNY hospitals at Brooklyn, Stony Brook, and at Syracuse, provide services that are vital to their communities. We serve uninsured patients, underinsured patients, and quite frankly, we get a lot of referrals from the private hospitals where they transfer patients over to us because the medical care would be long-term and very expensive. So there is a considerable cost that accrues to the hospitals, and those subsidies have been in place to recognize that need, and to eliminate them 100% is going to be particularly devastating. And on top of that, the governor has reduced in his budget the Medicaid funding by almost $3 billion. And since there's a dollar-for-dollar match with the federal government, it's almost a $6 billion cut. Now, that's going to affect health care across the state, but more particularly at the public hospitals where they serve a lot of patients that are dependent upon Medicaid for funding.
Well, how much are you hoping to see restored by, pushing lawmakers and the governor's office to really see the greater picture and where you guys are coming from?
Well, I wish we could get restorations. I mean, that